It's a good question, and when you asked me this last week, I said that it was an accidental one, and I stand by that. So I'd finished my training at the end of 2014, and I was truly at a crossroads in terms of deciding what next, whether to continue with clinical medicine or to take an opportunity which allowed me to perhaps look at something in a little bit more depth, and this position happened to be available. And I guess what I've learned over the last 18 months is that research is wholly absorbing and exciting and gives you a reason to get out of bed in the morning, because it's that question of why and how does that happen. But I guess the tipping point for me was actually not so much those powerful questions of why or how, but my experiences in the clinic. So I started off doing a clinic in skin lymphoma, something that I'd never seen very much in my training as a junior haematologist, and became aware how powerful clinical trials can be in terms of delivering therapies to patients who would otherwise not have access to those therapies, or expanding the pool of treatments to which we think might be applicable to the pool of patients. And I think that's a general principle that will continue to sustain me throughout a research career, is that power that the things that Mark and people like him are doing in the lab to translate into delivery of treatments to patients who would otherwise have terrible prognoses or poor quality of life.